What we are seeing now is a new era in cancer medicine, because what I see today, I had not seen before in my 50 years of experience. It is very impressive, and it is because of immunotherapy. I've been in cancer research and treatment for 50 years. I have seen the evolution of cancer therapy. We started with chemotherapy. Then we saw the explosion in cancer medications and drugs. And then the second phase was the emergence of biological therapy, like interferon. Biological therapy is when you give the patient a medication which is biologically present in his body, but you give it in a bigger dose. It is called biological therapy. Then I witnessed the emergence of the third phase, which is targeted therapy. Targeted therapy is when you give a drug that targets the cancer cell and spares the normal cell. You see, when you give chemo, the drug goes to the cancer cell, it attacks it, but it also attacks the normal cell. With targeted therapy, the drug attacks only the cancer cell, which was a major development, targeted therapy. But now, and in the last 5-6 years, we have witnessed the emergence of immunotherapy. What is immunotherapy? While all other therapies in cancer targets the cancer cell and tries to kill it, in immunotherapy, you give a medication that does not target the cancer cell. It targets the immune system of the body. It enhances the immune system. It releases the brake that the cancer cell puts on the immune system, and then the immune system itself attacks the cancer cell. So it's a different route for killing cancer cells. Immunotherapy also differs from chemo in the sense that the responses you achieve with immunotherapy are more durable than the responses you obtain with chemo. And of course, the toxicity of immunotherapy is far less than the toxicity of chemo. There is no treatment that does not have toxicity. But certainly if you compare the toxicity of immunotherapy to chemo, the toxicity of immunotherapy is relatively minimal. All other therapies go directly to the cancer cell. But immunotherapy, it makes a detour. It goes to the immune system, it liberates it, enhances it, it gives it power, and it will tell it, go. And the immune system goes to the cancer cell and kills it. It's a new approach, a new philosophy of therapy. Now, what we are seeing now is that diseases that did not respond at all to chemo, target therapy, and other therapies are now responding to immunotherapy, like melanoma. Melanoma was a disease which was looking for a drug, a good drug. We did not have a good drug for melanoma until 2011, when the first drug in immunotherapy was out, and it was called ipilimumab. Now, also in diseases that respond to chemo and target therapy, we are witnessing something new, and that when you add immunotherapy to chemo and to target therapy, you achieve responses we have not seen before. And I would give you an example. We have recently 2 patients with lymphomas. Lymphoma is a cancer of lymphatic tissue. Both patients were told by major cancer centers in America that they are not only terminal, but they are hopeless, and that these centers could not offer them any additional treatment. We treated them with this combination. We didn't know whether this was good or not, but we knew theoretically that it should work. So these 2 patients who were told by the best cancer centers in America that there is no additional treatment for them, and we gave them the combination of immunotherapy plus chemotherapy plus target therapy. Both patients achieved complete remissions. All symptoms and all signs of visible disease disappeared, which is a tremendous for patients who have been told by great cancer centers that there's nothing for them. These responses did not exist before, and therefore I strongly feel that we are now cruising through a new era of cancer therapy. And we feel that the combination of immuno plus chemo plus target therapy is a combination which is going to change the course of cancer treatment. It's something very radical, very new, and very effective. We have seen responses in lung cancer, and melanoma, and kidney, and bladder, and ureter, and lymphoma, and head and neck. But take, for example, breast cancer. We have not seen yet an impact of immunotherapy on breast cancer. But at least we can say that immunotherapy has shown to be effective in a disease which is the most common cancer in the world, which is lung cancer. Of course, we are talking about a few patients, but these few patients and these responses are very meaningful. This is the kind of observation that would lead us to the next phase where we say, listen, we are seeing something we had not seen before with such a philosophy of treatment. Let's design clinical trials and treat hundreds of patients, not 1 and 2 or 3 and 4. But the observation I'm talking about is extremely significant, and we should not lose the momentum. I'm very optimistic that we are making major progress every year, but that myth that we will wake up one day and there is one pill, one drug that could cure all kinds of cancer, I think this is very remote and is almost unreal. What we are going to witness is increments of progress. And what I would like to emphasize, that the increment in progress with immunotherapy is a big one. For the last, let's say, 6-7 years, we didn't make much progress. The increment was small. But I believe, and this is going to be shown, I think it will be reflected in clinical trials within the coming few years, that the combination of what we are doing now of immunotherapy plus chemo plus target therapy is going to be very impressive, very impressive.